represent, man?
Big money bound.
So let her know, man.
Big money bound.
Big Money Bound TV, RRT Posse YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time, but I also release some unscheduled videos throughout the week. Now, if you're returning, hey, welcome back. I appreciate all of the support. Thank you. Last night, man, I was all right. I had all right. My night was all right. Now, the hospital was crazy busy, but where I was at, it was all right. So my day started off, I'm on the floor. I'm on the floor like, let's say, 5 Northwest. I'm on 5 Northwest. On the floor where I'm at, they call it rapid response. I'm like, thinking to myself, like, I hear rapid response, 5 Northwest. I'm like, bro, if I'm right here on 5 Northwest, why would you not call me first to come check out what's going on before you call the rapid response? But I'm like, all right, whatever, man. Let me go ahead and let me see what's going on. Patient, saturation is low. Patient is on a high flow device. 100% high flow. What should you do now? Y'all probably saying increase the flow. The flow turned up to the max. It's on 40 liters. 40 liters is the max for this high flow machine. There are certain high flow machines that can go up to 60, 65. But if you ever felt 40, or if you ever felt 40, that's a lot of force, man. Hey, that's a lot of force now. I don't see some of them on 50 and 55. But 40 is a lot of force in your nose, dog. So, hey, how they do it, the police officers, before you can use a taser, you got to get tased. I think if they did that with a high flow machine, we'll be a little bit more reluctant to put somebody on 40 liters per minute, bro. Cause that's a lot of flow, man. So the next step that you should already said and been thinking about was BiPAP. It go nasal cannula, Venturi mask, oximizer, high flow, BiPAP, intubation. After intubation, ventilation. If you don't make it on the vent, the next step after the vent is the upper room. The upper room. That's it, man. That's your next step. Is, hey, man, it's back to ashes, ashes, dust to dust, dog. That's we come in and we go out. That's circle of life, man. That's a circle of life. So I put the patient on BiPAP. Everything returned to normal. But when you call a rapid response, now you got to do a lot more stuff. You got to do like blood gases, pre and post. What's your name? What's his name? First and last name. Ask me, Randy, what's your last name? Money. No, your real last name. Hey, Money. What's that? My last name can't be Money. I'm telling the Money straight up, dog. Like, for real, man. I'm telling the Money. So, like I was saying, the hospital is, like, jam-packed, man. Like, it was so packed to the point where it was vents in the ER that was supposed to come up to the floors. But the hospital is so packed, it's like, it's not enough staff to meet the needs of the patients that need to be taken care of when they come up. So you got to keep them downstairs where you got nurses and doctors at. Because up here, everybody already busy and they maxed out how many patients they can have in the unit. So they come, the therapist come telling me like, yeah, it's a problem downstairs. We can't send the patients up. I'm like, where y'all trying to send them up to? They're like, oh, I'm trying to send them up to you. Ain't no problem at all. Ain't no problem. Keep them there. What's the problem? I don't see no problem, dog. Tell me I got less work? I don't see no problem, bro. I'm just, yeah, I don't see no problem. Keep them there, baby. Keep them. Speaking of problems, man. I hate having to like try to fix a problem over the phone. Like somebody calling me, hey Randy, this is what's going on with this machine. This is what's going on. It's making noise. This and that. Okay. All right, let me come out there. Let me check on it. I don't like to say, well, hit this button, press this, and press that. They taught me in school, man, like to ensure that there's always a respiratory therapist on duty. Never delegate your tasks to a nurse. Oh, the patient need to go on BiPAP. Yeah, just put the mask on their head and press the start button. No, hey. Yeah, that's simple and easy, but that's respiratory therapy job. This is the point. If somebody else just keep doing your job, they're gonna be like, do we really need you? Like, I never delegate none of my work to no nursing staff ever, bro. I don't care what it is, man. Like, hey, I'll be able to do it. I'll do it. But that's just from the program I was in. You feel me? That's how I was taught. They kept reiterating that, like, over and over, like, never put your job off on a nurse, even if they can do it. Don't do that, man. Hey, this machine is alarming. Patient saying don't feel good, don't feel right. Oh, readjust the mask and start the machine over. No, I'm gonna go in. I'm gonna check out what's going on. Even if it's just a simple hitting the silence button and resetting the alarm, they don't know that. They think I just did rocket science, and that's how I'm gonna keep it. You feel me? I did something crazy. What you did to it, Randy? I had to go in the back, pull out my wrench, go into the back, shock up something, do a battery charge, pulsate this here, and squeeze 3 times, and kiss it 1 time, and then blow up. Hey, they don't know what I just did, dog. I'm telling them all kind of stuff, man, but a nurse called me. I'm covering like 2 different areas. Like, I'm a distance away from, like, if I'm in one place, I'm a distance from this place, and vice versa. Nurse calling me. Hey, man, patient ventilator is alarming. It's saying patient not ventilating. When you use a vent as a BiPAP, with the servo eye, you can use the vent as a BiPAP. So when the vent is like disconnected or it's too much of a leak, it's gonna stop ventilating because it's gonna feel like it's not attached to the patient, and it's gonna alarm you and let you know that, hey, this need to be somebody need to come and check it out. So they telling me, yeah, the patient not ventilating. They're not ventilating. It's saying not ventilating. I'm like, hold on now. If you on BiPAP and you ain't ventilating, that's something that's serious. But I can't hang up the phone and say I'm on my way because I'm a distance from you. So with that, I gotta try my best to explain like what's going on. Like, keep the nurse. When it's respiratory therapy and the patient deside and not breathing, nurses are gonna panic, man. That's just how it is. That's why they call it therapist. Oh, I'm so glad to see you. Nobody know what a respiratory therapist is or how valuable a respiratory therapist is until it's a cold blue, rapid response. They need CPR. They need intubation. Now everybody know what a respiratory therapist is. Before then nobody know what a therapist was. Now somebody can't breathe. They turn blue. We need a respiratory therapist now. Oh, now you know me. So that's how it go, man. So he's like, yeah, Senator, they're not ventilating. I'm like, all right. Is the mask on? They're like, yeah, the mask is on. Is it a good seal? Yes, a good seal. They're like, oh, you know what? The piece came disconnected from the mask. All right. Reconnect that. As soon as you reconnect it, it should start back to ventilating. Okay, she reconnected it. She's all right, it's working now. Everything's going good. Bingo. I normally don't like to do that over the phone. But for an emergency situation, patient not ventilating, bro, you got to hook that back in and let it start to work. Now, I'm on my way there to make sure everything is good. I'm going to double check, but while I'm en route, you got to figure it out. If I'm en route, you got to figure it out. That's all I'm saying, man. Speaking of figuring stuff out, y'all know me. I tell y'all all the time, man, like, I'm the ABG king. I know all the tricks. I never miss. My last shift before this one, bro, I had a patient, COVID now. Like I told y'all, with the COVID patient skin, it's like a real thick viscosity. Like, it's real surreal, like, thickness and, like, very, like, it ain't normal, bro. It's like the texture, the skin is, like, almost, like, gluey, man. It's not normal, man. So, it's a difficult stick. I'm trying. I tried, like, twice. Radial and brachial. I missed both. I'm like, man, what? I'm the person that they call when they miss. So it was at the end of my shift. So I just told the therapist that was coming on next to say, hey, man, it was a difficult stick. I couldn't get it. So just go up there and try it once you get a chance. All right, they tried. I come back to work the next night. I got the same assignment. The therapist said they got the blood gas. But they did say it was very, very difficult. They would say they tried more than 3-4 times. Because we got to get the blood. We got to get this gas. We got to get the blood. Somebody got to get it. You feel me? So the therapist kept trying. He kept trying. So I'm like, all right, man. But I just kept feeling like, dang, I don't miss blood gases, bro. So what happened, I was in the unit last night. A therapist that was in the ER was having trouble getting the blood gas. They know I'm the best at doing it. They called me. I took care of it. I did that because I know the trick. Then that same patient who I missed on, who made me miss. So I'm 8 million for one. You feel me? Out of 8 million, I missed one. You feel me? So that patient had a blood gas again. I was gonna be like, oh, I'm like, man, I don't feel like going to go try this blood gas because it's a difficult stick and I couldn't get it. I'm like, you know what? Let me try the opposite hand. Checking for the pulse. Got a pounding pulse in this hand. The other hand, it was so much slightly. Being a skilled therapist, I should already know to have checked the next arm. You feel me? I should already know that. But I must admit, after working a long 12-hour shift and it's your last assignment, the last thing to do before you leave, your mind could be a little bit like cloudy and you ready to, like, you feel me? You ready to go. You ain't thinking straight, but you still trying to perform your job to the best of your abilities. So, at the end of my shift again, I tried the opposite hand. I mean, I got it bingo, nice and easy. Like, what was the problem over here? You feel me? So that just made me feel a lot better knowing that, like, I know I missed, but I got it. You feel me? I came back and I got it. I tried again. I took another shot. I took another shot and I got it this time. So that made me feel a lot better, bro. Cause I was like, man, I don't miss blood gases, bro. Y'all know me, though. I ain't supposed to miss no blood gas, but hey. Y'all be easy out there, man. Stay safe, dog. I'm asleep, bro. What this is like this is my third day in a row. I'm gonna have 1 or 2 off. Then I'm gonna do a 5-piece. How bad you want it, dog? Big money bound TV as possible, man. All I did was go to school, dog. Finish that program and go ham. Finish the program, then go ham, man. Y'all be easy, though.